do you think the government of India will release?
How do you go about in solving this?
Did you receive any feedback from somebody?
A big leap from the normal thing that happens in
Yes.
On the environmental science curriculum for
Kusangpo, and a very warm welcome to the English segment of the Current Affairs program. And today we'll be talking about the hepatitis disease, and we'll be covering about the challenges faced currently in the country when it comes to treating hepatitis disease, and then we'll be talking about the treatment and also on the preventive modes. And to talk about this, I'm joined by Dr. Guru Prasad Tatkal, the gastroenterologist from the Jigmedu Joint National Referral Hospital. And then I'm also joined by Chong Tamang, the Deputy Chief Program Officer from the Vaccine Preventable Disease Program, Minister of Health. Welcome to the show. Now, to start with, first of all, what actually is hepatitis, doctor?
Hepatitis, the term hepatitis means inflammation of the liver. There are various agents that actually can cause hepatitis. There are some viruses, there are some bacteria, some chemicals can cause inflammation of liver. There are some medicines which can cause inflammation of the liver, and even alcohol can cause inflammation of the liver. So in general, hepatitis means the inflammation of the liver.
Yes. Sir Chong, if you could share us the current scenario of the disease in our country.
Actually, we have not done any kind of hepatitis B prevalence so far, but one we have done in 1995, and that time the prevalence of hepatitis B was above 5%, but it was quite long in 1995. But now, as doctor has already said, we have done just in April, May 2017. So maybe this will give the clear picture, the true burden of the hepatitis B and hepatitis C in the country.
Yes. Doctor, now looking at the concern over the disease, every year the World Hepatitis Day is also marked. So if you could share something about the theme this year.
Well, Hepatitis Day takes place on 20th of July every year, and it is actually the World Hepatitis Day brings the world together to create awareness under a single theme. The theme this year is Eliminate Hepatitis. It's useful to know the background of this theme, because on the 69th World Health Assembly held at Geneva, 194 countries have actually signed, they have adopted the World Hepatitis Strategy. And under this, one of the goals is to eliminate hepatitis by 2030. So based on this adoption of the agenda, and the theme for this year is Eliminate Hepatitis.
Yes, Doctor, one thing, if you look at the statistics that I actually got, if you look at 2012, the rate of disease, people who were actually detected was like a little more than 200, but in 2014 it came like close to 800. So looking at the increasing trend, do you think that it would be possible for Bhutan to eliminate hepatitis by 2030?
First of all, let me try to give a scenario. I think it is not appropriate to say that there is increasing trend. Probably because the disease was already there, but we are diagnosing more. So various strategies based on the adoption of the agenda, the health ministry has already started implementing those strategies. So health sector strategies have already been adopted, and we have already started implementing those. And in fact, it's not only in Bhutan, but all these 194 countries have already started adopted, and they have already started implementing various strategies. So with these various strategies, I think by 2030 we'll be able to eliminate hepatitis. Now, when we are talking of eliminate hepatitis, we are basically talking about hepatitis B and hepatitis C. So I think it's appropriate.
Yes. So now when it comes to the ministry, how widely do you all carry out awareness?
Actually, awareness is not only from the ministry we do, but it is as a package, as a awareness. It is included in all the Jongkaks law. Even we do like high level advocacy every year, and this is it goes as a package. not only for hepatitis B, but it goes as a general package for all the health activities.
That's Dr. Well, again, one thing, why is it important for us to mark this day now?
Before we know this importance of World Hepatitis Day, I think it would be appropriate to know why is hepatitis so important actually. Hepatitis actually is the one of the major causes of death worldwide. It causes about 1.4 million deaths every year. Together with that, 80% of the liver cancers are caused by hepatitis B and hepatitis C. Hepatitis is a global burden. I mean, it is not distributed to one section of the population or one part of the world. So it's a global problem. And about 4% of the world population are infected with hepatitis B and hepatitis C. But sadly, 90% of the people with hepatitis B and 80% of the hepatitis C are not aware of their viral status, which means at one point of their life, this population is going to develop severe liver disease. Besides that, to prevent these, the awareness has to occur. Now, with the adoption of hepatitis as the Sustainable Development Goals and adoption of the World Hepatitis Strategy, we have come to a pivotal point. And it's an opportunity for all of us. When I say all of us, it's an opportunity for the policymakers, it is opportunity for the corporates, it's opportunity for the media, if it is the opportunity for the health personnel, and it is the opportunity for the patient with hepatitis viruses to create awareness on the burden of hepatitis, and also to start effective strategies to prevent them, and then those people who are already infected to bring into treatment and care.
Sir, like doctor said, like most people, they have the virus in them, but it's detected later. So, is the ministry doing anything to have early intervention so that the disease is diagnosed early?
No, that's the main strategy for the advocacy, so that people can come forward for their checkups. Not only at the time of the sick, when they got sick, then only they come forward for checkup. But they can go for the routine checkup also, for other tests, including this hepatitis B.
Yes, doctor, in Bhutan, what are the common causes of hepatitis B and C now?
Well, do you mean to say which is more common?
Yes, which is more common and what's the cause for this?
It's very difficult to say which is more common. The picture will be clear once we get the result for the survey, nationwide survey, which we have carried in April. But with the number of patients coming to avail treatment at JDW NRH, it looks like hepatitis B is more common than hepatitis C. Now, in hepatitis B, probably it is mother-to-child transmission, which is causing infection in the children, and that is leading to chronic hepatitis B. And in case of hepatitis C, probably it is the sharing of the needles among the intravenous drug users, which probably is the common mode of transmission. But again, I say that the picture will be more clear when we get the results for the survey that we have carried out.
Sir, now when you say vaccination, mother-to-child transmission, what are the vaccination rules that you all are having at the moment?
Let me start. The hepatitis C vaccine, first we started in Bhutan in 1997, and we give 3 doses. So at 6 weeks, 10 weeks and 14 weeks. So child should take all 3 doses complete for the protection. Then 2012 we started for hepatitis B birth dose, so which is given at birth dose, at birth within 24 hours. The reason for giving the birth dose within 24 hours that if the mother has hepatitis B positive, so there is a almost high risk for getting transmission of the virus to the newborn baby. So because of that, we are giving the hepatitis B birth dose at within 24 hours.
Yes. Doctor, hepatitis and HIV now, is this two virus Can you relate these two viruses together, like, as it's both like transmitted to sexually transmitted diseases?
Really, no.
Yes.
These are two different viruses.
Yes.
Only common in them is the mode of
Mode.
transmission. Like the routes through which HIV is transmitted, through the same route hepatitis B can also be transmitted. That's why when we advocate the prevention of HIV, hepatitis B can also be prevented. But other than that, we all know that hepatitis B affects the immune system, and due to the suppression of immune system, we get various infections, and then people develop different diseases. Whereas in case of hepatitis B, it only affects the liver. So the risk of having hepatitis B being harbored in your body is that in the long run, the patient who harbors the virus may develop cirrhosis, that is the the shrinking of the liver, and various complications because of that, and also the liver cancer. So actually we cannot relate these two viruses other than the route through which they are transmitted.
Yes. Now, doctor, now again the mode of transmission, as you have been dealing with a number of patients, like you must be knowing, like, which is the highest mode of transmission? Is it sexually, or is it mother to child? Or?
It is again difficult. Probably we'll come to know after we get the survey report, because sometimes when we ask the patient about what probably is the mode of transmission, people are shy to talk about their private lives. So in all reality, I mean in all probability, I'm sorry, it may be mother to child transmission, which is more common in Bhutan.
Yes.
But I again say that once we get this survey report, the picture is going to be more clear.
Yes. Can this disease be prevented now, mother to child?
Yes, yes. We are very grateful actually to the policymakers that we have started screening the pregnant mothers during antenatal visit for hepatitis B and hepatitis C. So if a mother is detected to have hepatitis B virus, then we have actually three means to prevent the transmission from mother to child. First of all is, as soon as the child is born, we can give one injection called hepatitis B immunoglobulin. The injection has to be given within 24 hours after the child is born. The second prevention strategy is we call it zero-dose hepatitis B vaccine. So within 24 hours, we also give hepatitis B vaccine to the baby. And recently, we have started treating the mothers with very high viral load in their blood. When the viral load is very high in mother, there is high risk of transmission of this virus to the baby when the baby is in womb. So we treat this mother with antiviral medication to reduce the dose of virus so that the risk of transmission from mother to child is reduced.
Yes. Yes, doctor, overall, not just mother to child, can the disease be prevented?
Definitely, definitely. So basically when we find out the route of transmission, there are various routes of transmission of hepatitis B from one person to other. As I said, one is from mother to child, the second is through sexual route, and the third is when there is contact of blood, when infected blood is transmitted to a non-infected individual. So when we target these three routes, the prevention, the transmission can be prevented. So one of the means is immunization, which the Royal Government of Bhutan has adopted since 1997. Even those adults who are at high risk of getting the virus actually can be immunized, and the virus transmission can be prevented. Now, to prevent transmission from through the blood is that we screen all blood and blood products, and we don't reuse the syringes and needles. All the equipments that are used in the hospitals are sterilized so that the virus is not transmitted through the instruments. Now, those people who already have the viruses, actually, they can prevent the transmission of this virus to other healthy people by not sharing the needles, not sharing the razors, not sharing the toothbrushes, because anything that is contaminated with blood, if that blood is contaminated and goes to the bloodstream of other healthy individuals, the virus can be transmitted. Now, the most important thing is transmission through the sexual route. I think that we need the behavioral change.
Yes.
And of course, when we are carrying out the advocacy on prevention of HIV, since one of the routes of transmission of HIV is also through sexual contact. So the same prevention strategies will also prevent the transmission of hepatitis B to others.
Sir, now when you say vaccination now, why is it only for the children? Can't the adults also get vaccinated?
No, actually, like when the infant, during the time of infant get infected with the hepatitis, there is a high risk having the chronic infection with the hepatitis B, especially when the child get hepatitis B during the under 1 year of age. So, but when you get in the adult, there is a chances almost 95% disease will be like cure.
Can I just supplement to what Mr. Chiang says? Actually, those people who have at high risk of getting the hepatitis B, as I said, people who are, who need to take these blood and blood products frequently, people who are undergoing dialysis, people who have multiple sexual partners, people with other high risk, like close contact of patient with hepatitis B. By close contact, I mean the spouse and the family members and the health workers. These are the people who are at high risk of getting hepatitis B even when they are at adults. So this category of people, when they come to the hospital, we actually immunize even though they are not children, even though they are adults. So there is a facility and there is a role of immunizing adults.
Yes, now the disease, what are the treatments that you provide currently? Is it curable once you get the treatment?
I think this is a very important question because people should know about this. Basically, when we talk of hepatitis, we are mainly talking about hepatitis B and hepatitis C. Hepatitis C is now curable. 95% of the people who are put on the treatment for hepatitis C are now getting cured. Now, the duration of treatment varies from 3 months to 6 months depending upon different type of hepatitis C viruses. Having said that, the treatment is pretty expensive. A 6 months course of hepatitis B medication may cost anywhere between 80,000 to 100,000 nilram. And the medications are available in India, and we have already started treating patients with hepatitis C. So far we have treated maybe about 5 patients, and the result is very good. Now when it comes to hepatitis B, we have the medication to suppress the virus in the body and to prevent the long-term complications like cirrhosis and liver cancer. Once we start the hepatitis B medication, we may not be able to eliminate the virus and therefore cure it. But once we start the medication, we'll definitely reduce the risk of liver diseases and liver cancer in patients with hepatitis B, but the treatment may be lifelong. And we do have the medicine to suppress the virus in these patients. It's available in Bhutan.
Yes. Sir, now when you say like the treatment, what is the financial implication borne by the government when it comes to treating hepatitis?
Actually, we didn't calculate the cost per child, but annually government we are spending 5.5 million for the procurement of this hepatitis B vaccine only.
Yes, doctor, you mentioned about the need of behavioral change. Now, does this also include diet and something like that?
Not really. When I talk of behavior change, to some extent yes, but not that you have to restrict so many diets. By behavioral change, I mean to have as fewer sexual partners as possible, reduce the sexual partners, use barrier methods of contraception, and especially people with hepatitis B and hepatitis C, it is advisable not to go and take street foods which are not very hygienic, because these foods may contain hepatitis A and hepatitis E, which are transmitted through food. And somebody who already harbors hepatitis B and hepatitis C, if another virus gets in through food, then the risk of liver failure and death is very high. So hygiene is the only thing which we need to maintain. But other than that, restricting alcohol is one thing, because alcohol and tobacco will hasten the liver damage. Other than that, there is no dietary restriction when it comes to a person who is just harboring hepatitis B and hepatitis C viruses.
Yes. Can the disease cause death? Like in Bhutan, what's the rate of death if you have stats over the years?
Sorry, again, our statistics is very poor. We cannot say what is the cause of, what is the rate of death. But definitely, if we don't treat the hepatitis B and hepatitis C viruses on time, then these people usually develop the cirrhosis of liver and liver cancer, and the death usually occurs. But it doesn't again mean that all people who are harboring hepatitis B and hepatitis C will develop cirrhosis or liver cancer. Only about 20 to 30% of the people harboring hepatitis B virus may ultimately develop cirrhosis of liver and the complications of cirrhosis of liver. And only about 20 to 30% of the, again, hepatitis C virus patient may develop chronic liver disease. So, of course, the rate of death in people with hepatitis B and hepatitis C is higher than the people who don't harbor it.
As of now, doctor, what do you see? Like, are our Bhutanese people like really forward in coming and getting themselves screened for blood tests and all that? Should they like buckle up now?
Yes, because as I said, 90% of the people who are harboring hepatitis B virus and 80% of the population who are harboring hepatitis C virus do not know their status. So if we don't know our status, any one time in life we are going to develop chronic liver disease. And again, the risk of liver cancer is very high. So unless we screen, we will not know whether we are harboring the virus or not. So I would encourage people to come and get yourself tested. And if we can test and detect early, we have the medicines. For hepatitis C, there's a cure now. And for hepatitis B, we have the medicines which will suppress the virus, which will prevent the development of cirrhosis and liver cell cancer. So this will prolong the life of people who have with hepatitis B. So when these facilities are available, I'd encourage the people to come and get yourself tested, know your status, and if you know the status, come to us. We can always help. In C we can cure, in B we can always prolong the stage of the disease. Actually, the stage from going from just hepatitis to cirrhosis can be prolonged actually.
Last sir, now since we are running out of time, if you have anything to add on, which we could not include in our session.
Actually, just I want to give some sort of information regarding this hepatitis B birth dose. Though we are giving the at birth within 24 hours, but those have delivered at the health facility only. So those who are delivered at home, they are not able to service for within 24 hours. Maybe I think my message to our people is maybe like mothers, they should come forward for delivery in the health center, especially not even necessary to go to the hospital, but even in the rural area, they can go to the BHU, basic health unit.
Yes. That's Dr. Last minute, I'll give it to you now.
Thank you so much. What I would to say is eliminate hepatitis is not a public health goal. It is an individual goal actually. It is the goal is my goal, it's the goal of the media, it's the goal of the health workers, it is the goal of the patient with hepatitis to create awareness on people to know the status of hepatitis B, get yourself tested, and if you know the status, to come to the doctor so that if we diagnose early, we can cure hepatitis C, we can actually prevent the complications of hepatitis B like liver cell cancer if you start the treatment early. So let's all take the responsibility of creating the awareness on hepatitis and make this elimination by 2030 a reality. Thank you.
Let's doctor again. One last, sorry. As we talked with some patients and some people, they still have some reluctance when they want to talk about hepatitis. Yes. Is it something to feel shy about?
Well, probably because the route of transmission of hepatitis, one of the routes of transmission of hepatitis B is through sexual contact. So when somebody is said that you have hepatitis B, people might be thinking that, oh, this guy must be promiscuous, this guy must be having risky sexual behavior, so that he must have got the viruses. But it is important to know that it's not only through the sexual route that virus gets transmitted. The person would have got the viruses from mother, you would have got because he had shared an injection, or you would have shared the razors or toothbrushes with person who had hepatitis B. So yeah, there is some reluctance, but once we create awareness, I'm sure this reluctance to come and talk with doctors will go.
Las, thank you so much for your time, Las. With this, we come to the end of the program, and I would also like to join my two panelists here in encouraging the general people to come and get tested yourself for the disease. It's nothing to feel shy about, because it's just like any other disease. There is a treatment, there is a cure, and it can be prevented as well. Thank you so much for watching.
So do you think the government of India will release?
How do you go about in solving this?
Did you receive any feedback from somebody?
A big leap from the normal thing that happens in
On the environmental science curriculum for